families, low-income families, are leaving the city. We're losing those folks. That's impacting our schools. It's impacting the fabric of our society.
There's a deep individual impact to household affordability, and it's far broader than the poor people who may not necessarily impact me directly every day.
Transportation is a big issue, and it's not just traffic getting in and out.
We have poor or failing infrastructure outside the urban core.
Way too many people who are underemployed, working 2 and 3 jobs to make economic ends meet. And in large part, that's because they lack the skills necessary to obtain jobs in the upper end, the upper stratum of our market.
In our community right now, probably over 250,000 people are infected with HPV.
People have gone out there, bought their insurance, they can afford the premium, they can't afford the copay and deductible.
People come directly from India to here. They really need a lot of help to understand the American culture.
Finding Spanish-speaking clinicians in Austin, it's very difficult.
We are a convener, connector, and informer, and our job is not to solve the problem, but to bring together, to convene all of those different agencies, nonprofit, faith, private sector organizations that are in that space, who are taking action every day. We're working to connect them to each other so that they can get a common understanding of the issues, a common understanding of the resources, and a common understanding of the barriers and the impacts that are being felt with all the shifts, the demographic shifts.
Tobacco is the biggest cause of preventable death and disability in our community. Tobacco kills more than AIDS, crack, heroin, cocaine, alcohol, car accidents, fire, murder, and suicide combined.
Many of our systems of care are not trauma-informed. So if we're able to identify kids who have experienced trauma early on and help them, we will be in a better place.
We know there's like training available for the youth. They can go to a lot of you all providers and get those kind of skills. But one thing they don't have is the social emotional maturity to actually follow through with these things. They get enrolled at ACC within like the first 4 weeks, most of them drop out.
There's shelters for men, but there's not enough shelters for single females or females. There's not shelters for females with children. You break up the family unit.
An important systemic change was supporting family caregivers. Right now, family caregivers are providing enough care that equals all the Medicare and Medicaid spending.
Child care, when a person is has an appointment or has a need, a lot of times they're making a choice between their children and their own health.
If you're busy working, you're not busy training. One model that has been very effective in this is an earn while you learn model.
There needs to be more industry commitment to providing child care at work. That eliminates a lot of the barriers for especially single moms.
People don't often reach out or know to reach out for assistance other than just going to the emergency room. So there was a big push at our table about focusing how we might do outreach out into the communities and some things we've already heard about into the churches, into the schools, into the neighborhoods.
Right now we have 11 campuses. We continue to open new ones. So we want to build where people are at, and we want to offer low tuition fees so that people can afford it. We want to help people get financial aid.
We're seeing much more complex cases that show up to our service providers' offices. Okay, people who have not just a housing issue that needs to be resolved, but a food security issue, a transportation issue, an education issue, a health issue that needs to be resolved. So the cases are much, much more complex. And clearly, with that complexity, there's a need, an attendant need for collaboration.
Area SWAT teams. In those areas where individuals need services, they don't need to be sent from one organization to another organization to another organization. They need to be able to come into one facility and get the services that they need.
Having a stronger navigation system online, in person, more of a person-centered approach.
I would like us to work together. I think that every organization has a strength in some sort of like aspect of a cultural competency, grid, graph, whether it's language, whether it's LGBT, whether it's the 5%, whether it's something. So why recreate the wheel when someone is doing it in this room in some capacity?
We have tremendous duplication of services because our systems are fragmented. They don't talk to each other. And one of the solutions is just creating, using technology to create the health information technology systems that will connect our providers.
So I think there needs to be a new term in which when the schools are picking up a responsibility around behavioral health, when pastors are taking mental health first aid, when we have a situation where we have quick screens in terms of central booking, it's the whole community taking some ownership around not having folks slip through later in their illness for services.
And we really need to launch a true recovery-oriented system of care.
We decided we need more patient-centered care and control.
We have to educate our population, and in order to educate, we empower them. And it's not, regardless if you're homeless, HIV, STD, whatever, you're still a human being, and you deserve that warm human touch. And you have to be validated as a person. And it doesn't matter your lifestyle. It doesn't matter. We don't care about that. We're not here to judge. We're here to take care of you and prevent. And that's what we have to give to the people.
Having the people in the community be a part of the intervention and discussing how they would like, what needs they would like to see men, and particularly youth. Using those youth as peer health educators, allowing them to be those that get empowered and transfer that information to their other peers. Because a lot of times adults, we give the information, but the most effective thing is to hear from someone that looks like you and is your same age.
We'd like to see more trainings in the workforce that can build on the skills of the immigrants, the skills that they have and the gifts that they have.
The term that came up frequently was culture, applying both at a personal level and at an institutional level, and also recognizing traditions that may conflict with the services being offered.
How do I better meet the needs of the folks that I'm supposed to be serving? I can't know how to do that if I don't know who I'm serving. And so I think this is a critical issue here, knowing who you serve and making sure your staff is prepared to respond to that need.
So if you're able to connect to those populations at where they are, to be culturally relevant to what they do, to be diverse and inclusive in the things that matter to them and in what you're supposed to be providing as a service, then you're going to be more effective in providing those services.
Institutional racism, we all can perpetuate it through our practices, our policies, what we do, or what we're not doing.
The Latino population here in this area is not just Mexicans, it's very diverse. And so something that we have to keep in mind.
When you're talking about different Asian languages, African languages, they're not there at all, right? Or they're just really, really insufficient. So that's a huge barrier.
We do specifically train though around gender identity issues because if you're not honoring that person and having that conversation in a way that elicits that information in a way that they feel like they can be served, then they could fall out of care and have negative health outcomes.
There's a big issue of stigma in accessing mental health services. We discussed specifically the African American communities and the Hispanic communities and difficulty accessing mental health services and helping people understand that it's okay to seek help.
Individuals that are incarcerated, when they receive on-the-job training, part of that problem is that they can't use it when they come out due to their offense.
Looking at our consumers and determining if they can do all of a job or pieces of a job, and then talking to employers about the possibility of job carving. So many of them are scared to hire people with disabilities because they have no idea what that really means, what happens if somebody's mentally ill and they start to have problems. They're also afraid of the cost of a reasonable accommodation, which most of the time is either at no cost or a very minimal cost. We talked about the need for breaking down silos and normalizing coordination across sectors that may not be traditional partners. So for example, when housing is developed, especially affordable housing, and when healthcare facilities are sited or developed,
it's vital that transportation is at the table before those decisions are made.
Because it's much easier for us to give you advice, to give you insight, or to make changes if we know about it beforehand.
So that we don't continue to perpetuate this problem of having a dispersed population that can't access the care they need because they're located in areas that transit and other transportation services can't easily or affordably serve.
Senior-friendly villages and neighborhoods where, if you're not close to your family, but the whole community plays a part in being a part of the housing and taking care of the seniors who are living in that neighborhood.
Safe crosswalks and more parks and lighting and walking, maybe incentives for convenience stores and local shops to have like tax breaks or something so that they can provide more healthy food in their stores and so that it's more accessible to the people living in those neighborhoods.
There are opportunities for everyone here. There's no reason that we have the gap that we have. Both boats can be lifted. We just need to do a better job as a social service and education sector, of working more closely with the business sector to understand their needs, to see where our clients can fit in.
It really takes everybody within the community to focus on how we can come up with solutions to make sure that policies are changed.
It's all of our organizations together. It's the people that we serve. It's all of us together that can make this change or not.